No, tell me about your pain and your life before our surgery.
My pain level after, I think I was 63 when I came to see, 64 when I came to see you. I was very active up until about the 8 months prior to seeing you, and my pain level was a 10 or more. It was unbearable.
And you're a very professional person. You're a lawyer. You have your very busy life. And I remember every time I see you, you have a computer working already. That's how I would do that. But you couldn't really live your life anymore.
I couldn't. My life went from working and being very active socially and with my daughter, who's very active, to essentially going to work for as long as I could stand it, and then laying on my couch.
Okay. And you even told me that you were thinking about quitting the job because you just couldn't perform the job.
I couldn't. I could not. My concentration went because of the pain. I now know that pain affects much more than just your body. It affects your psyche too.
And you didn't have an easy problem. You had a scoliosis and in lumbar spine with significant side bending of the spine. And you start looking for options. What can be done? Tell me about it. What were the options you found out about?
The first option was intervention for the pain with injections and medications, which gave me absolutely no relief, and I don't like to take medication. I then explored what surgeries were available, and I learned there were two options. I'm a layperson, so I don't understand all of the technical terms, but I learned very quickly that one was a major surgery with a major incision for a long period of anesthesia on a table, which is what most of the surgeons in the area where I live were telling me had to be done.
Did they tell you about how long the surgery would be, how much blood loss?
Not a whole lot, other than I knew it was a long surgery. It would probably consume, I think what I was told, a half a day or longer, and it would involve blood loss. And what comes to mind, and I'm not sure who used the illustration, but again, talking to a layperson, it was about a ice cream bucket full of blood.
Almost, it's not unusual to lose half a gallon of blood with the open old-fashioned scoliosis surgery, and those surgeries are two surgeons working for 12 hours. That is not unusual, unfortunately.
And I guess from a personal level, I have a daughter whose father passed away years ago, and I'm not young, and I was in a lot of pain, and I thought this surgery is not worth it because I cannot make my child an orphan and be lost on a table, and I don't want to be under anesthesia for 6 or 7 hours. I then heard the name Dr. Abbasi from actually my partner in my law office, who said he had visited with someone who had had what he categorized as minimally invasive surgery, and that the gentleman my partner was talking to had great results. So I did what I think a logical person would do, is I crossed my fingers, called your office, and asked if I could see you without a referral, expecting, because of the insurance industry, that the answer would be no, you need a referral, and it wasn't. And I came to visit you, and I think, frankly, I kind of wish I had a picture of the day I came to see you, because I think I'm back to my normal self. But the difference is...
You mean you're back to your normal self now, comparing to before the surgery?
I'm back to my normal self now, before the surgery. When I was feeling good.
When you're feeling good, because you were feeling miserable at that point.
I wasn't miserable. That is not strong enough word. The word is, I was more than miserable. I don't know what the adjective would be, to tell you the truth.
Well, let me put it this way. Many of our patients, they're telling me they rather die than live like that. Many of our patients are telling me, literally, on record, they tell us they gather their pills to end their life, because if that's all what's to it, they don't want to do it anymore.
And I don't think I might, from a psychological standpoint, I would never get to that point because I have a child.
I know.
But no, it was not. there was no quality of life. I
Mhm.
couldn't drive without pain. I can tell you what I did is I worked on a daily basis as long as I could, which was not long. And then I went home and I turned on my TV, and I can tell you what happens. You get depressed, you get sad, you eat too much,
Yeah.
and you're inactive.
Yeah.
So other parts of your body go too.
Now, as well, I want to emphasize you're not that old in my book, not in my book. But so, meaning open old fashioned surgery would be still an option for you. But lots of people in their 80s, they have, or late 70s and 80s, they have same problem. Open old fashioned surgery is not even an option. A 12-hour, 8-hour surgery, half a gallon of blood loss, even 2,000 cc of blood loss, and so on. This is not even an option for them. So we tell them just go live it, or do things that they work maybe a little. They become drug addict, and then we have drug problems and so on. So open old fashioned surgery is not even an option for many for many patients. For you, it would have been an option, but you decided against that. What made you decide against the open old fashioned surgery and for our surgery?
Well, first, I am old. And secondly,
Not in my book.
when I would compare
Mhm.
an hour or so under anesthesia in the hands of a very accomplished surgeon who's making small incisions
Mhm.
and losing practically no blood compared to more than a half a day or
Mhm.
3/4 of a day under anesthesia, which I think has its own risks, with blood loss and at my age,
Mhm.
there wasn't a choice. I
Yeah.
think that it's, I can't imagine someone, if they're educated about
Yeah.
both options, so that they would choose the other way.
Yeah.
It makes no sense.
Yeah. Now, let's put it this way: that I have approached many universities to do this, teaching them this surgery with no cost to them, to their resident, and so on. And I have actually a record of that. That they do a 1 level. Yours was a 4 level. I'm going to turn around here. You got a 4 level, and your scoliosis is gone. Your spine going up and down. So that's corrected. But for just doing 1 level of that, they use 5 to 7 hours to do 1 level. And I have approached some of these universities telling them that, let me teach your resident. They said they have no time. And my answer to that is yes, if you need 7 hours to do 1 level fusion, if you need 7 hours to do 1 level fusion, where I do it in 40 minutes, it doesn't really leave you much time for anything else. But unfortunately, there are lots of other interests there, and it's hard to go back to learn this procedure. What would you say to the people, to universities, that they say open old-fashioned surgery is the only way to go? By the way, same surgery that people get damaged all the time. What would you tell them?
I would tell them that if that were an option, that any person who did their due diligence and checked on how things work, they would have no patience.
Yeah.
Because if you knew the difference, and I think I'm living proof of what the difference is, I would think they would not be in business doing surgeries.
Yeah.
I would use it as an analogy for what I do.
Tell me.
I've been practicing law for 35 years. And when I started practicing law, we used books and pen and paper and carbon paper. When I was told I had to start using a computer and computerized research, and there would be no more handwritten documents, I said, oh my gosh, I don't know if I can learn this. And I thought through it, and I said, I'm either going to learn it or I should retire, because if I can't learn it and I don't learn it, I'm not doing a service for my clients.
Yeah.
And therefore, someone else, younger, more with more energy, should be the one doing the work.
Yeah.
So I analogize it by you either learn or you harm your clients.
Yeah. Now, I think that I'm a little as well disappointed, because we as citizens, we put our public money in universities to make them the forefront, to look at the data, do things. And I'm disappointed that I approached the universities, many universities, and it seems that they are not interested. But I did look up the data of the previous development of technologies. like endoscopy, like laparoscopy. When you get a surgery in the belly, these days they don't make an open hole, they put endoscopes in. That has to be pushed and forced upon universities. That came from private practice, and it took 15, 20 years for the universities to adapt that. So this is nothing unusual, unfortunately. That universities that we put our public trust in them to look at the data, to be the forefront of the development, are actually more reserved to adapt to the new technologies.
You know, I haven't thought much about that, but when I think about it off the top of my head, I think it would be the opposite.
Yeah,
That
everybody thinks it's the opposite.
The private sector would be more hesitant than the teaching sector,
Yeah.
because aren't the teaching sector supposed to be cutting edge?
And that is the surprise that everybody needs to understand, that once you look at the data, universities are late adapters.
Yeah.
Endoscopy, laparoscopy, like what we know, it's so helpful to the patient. It came from outside of the university, and university were the last to adapt that. And that is the public data. You can Google it.
Yeah, well, it seems to me, I have a brother that's been a professor for years at a major university, and I thought it was always do the research and publish or die.
Yeah.
But it seems like you're saying it's the opposite,
Yes.
that it's the private sector that's developing cutting
In
edge
US it
things,
is.
and not the university sector.
Now, what do you remember? When you and we talked, I was very realistic about the risks of the surgery. What do you remember I told you about the risk of surgery?
I remember hearing about, and now I may not get the words correctly, but I remember all the normal anesthesia risks, all the consent forms, and I remember you talking to me about that something could happen with my nerves
Nerve
because of
irritation,
the,
yeah.
is it called nerve
Nerve irritation, yeah.
I remember you specifically telling me that because of the way things get moved around, to correct one problem, there may be an irritation of nerves.
And here you are, you got that nerve irritation.
Right. And you know, when I think about this too, in talking with more traditional surgeons, I believe I was always told there was no way to know if it would work. That nobody was guaranteeing a result.
Yeah,
And I think you told me the same thing. There's no guarantee of a result. But you talked a great deal about nerves, and I probably have what you were talking about, because I did have some issues with my leg after surgery, and I think that was nerve irritation. Right now, post-surgery, and I do my physical therapy, and I can't say enough good things about them either, but I have a little bit of tingling in my foot, in my left foot.
Okay. Now, how bad is that? I mean, how much is it limiting you? And you told me something about that. It's livable, and even if it was worse, you still would be happy. Tell me about it. What did you mean by that?
I tell everyone that will listen to me, and that's not everyone, but the people that do listen to me, that I would take the little bit of tingling in my foot times 1,000 compared to what I was going through. I have no limitation to what I'm able to do except in one area. I have a little bit of trouble walking stairs normally, because, and actually my physical therapist told me the other day that may be more psychological because I'm afraid. But no, I have.
No, you still have that nerve irritation.
Yeah.
It'll still get better.
But I can tell you, my physical therapist, when I started the therapy, they were very keen on knowing how, and I don't know why, on how much I can lift my foot, and their goal was to make sure I can lift them both consistent or to the same level, and look at. So it's.
So are you back in life where you want to be?
Yes.
So when was the surgery?
In May of 2020.
So not even a year.
No, it hasn't
Not even
been
a year. Where you told me that they have been telling you that the recovery would be much longer. What did they tell you about recovery after open surgery would be?
If I recall correctly, and I'm not positive, but if I recall correctly, I was told that I would not, there was no expectation that anything would dramatically improve for a year.
For a year.
But I don't remember specifically, but I always had that 1 year mark in mind.
Are you back to work?
I went back to work. I think you told me, I remember seeing a sheet that I should go back to work about October 1st full-time. I went back to work the end of August.
Okay, so within months you went back to work, and are you off narcotic?
I proudly say I haven't had a pain narcotic for months.
For months, good.
I take Tylenol maybe once a month, and I don't need anything for pain right now.
Yeah. Now, if you went through the entire process, many people haven't, but if you would have just summarize for people who haven't gone through that process, open old-fashioned surgery versus this, let's say this is like a intelligent squares, pro and contra and so on. What kind of argument do you think the other side can come with that this surgery should not be done, and the open surgery where we slash you open and lose half a gallon of blood and 1 year or 2 years recovery and so on? What do you think? What the argument could be not to do this surgery versus the other one?
Well, first, it's hard to comment on a surgery you've never had, but I can tell you after I visited with you and did my reading and watched the videos, there's no way I would have done the other surgery. I just wouldn't have done it. So
Yeah.
I don't know what would have happened to me, but what I can say is,
Let me tell you what some people say. Some surgeons say, they say the nerve irritation that you still have, that is the reason we should do the open surgery where we slash you open and do the big surgery. That would be, that they say that, and literally on the going from the front or side or back and so on, the old-fashioned way, with all its risk, they think the reason we should not be doing this surgery is that people may get the nerve irritation like you got.
well, I had and even at its worst, even in the first few weeks after the surgery, I still would not risk a 7 or 8 hour surgery and a major incision and blood loss because my leg didn't work right. I wouldn't, it doesn't seem to be an intelligent choice to me.
And we have a good data that what you got is actually most of our patients even don't have that. Most of our patients even recover much faster than you. Your surgery was under 2 hours. We lost about 150, 200 cc of blood, which is 1/10, 1/20th of open old-fashioned surgery. And still, I think there is lots of hesitancy for my community, for surgeons, to get on board and learn a new technique. And because, as you just described with your computer, it is hard to learn new things.
That doesn't make any sense to me, and I always, to make sense out of things, I always have to put it in a perspective in my life. And I can tell you how I would analogize it to my situation is that I'm a divorce lawyer, 35 years of doing this. And 10 years ago, there was a program started with mediators where lawyers were coming in and saying, instead of spending $50,000 fighting about who's going to have custody of your kids, let's try a different process. And I call it ADR, or alternative dispute. Lawyers didn't like it in the beginning. Us, the old traditional divorce lawyers didn't like these people coming in and saying, there's a better way to do this. And there's only one reason, because it's always better for the client to resolve their problems, have a result that doesn't take away their children's college fund. But guess what it did? It took away the income from the lawyers. So when I see a lot of change in my profession and I see the old guard resisting it, it usually means to me somebody's worried about their revenue.
That's you just nailed it. Now, in the court of public opinion, if the public is the jury and you are trying to convince them of what you got versus the other one, what would you tell people why they should in just a few sentences, why they should get, why is this better than what the other options you were considering?
Okay, you're going to make me cry.
Oh.
But what I would tell anyone, and I can't tell anyone technical medical information, that's why you trust your doctor. What I can say as far as personal
Mhm.
If you have family that care about you, first, it affects them because the pain becomes insurmountable
yeah.
and you're not yourself.
I'll be with you.
If,
Sure.
if you have a life that you want to continue, there is no question what I think anyone should do.
Okay.
Because the issue is, how do you get back to a normal life without the risk of death, without the risk of becoming in a situation that's worse than you began with? So I think I'm living proof. I would probably go, dance and jump on my horse to show somebody why they should do this.
Well, thank you so much. I really appreciate that.